Hello friends, my name is Dr. Sumesh Arora. I'm an intensive care specialist from Sydney. I would be talking about how to approach multiple choice questions in your preparation and in the real exam. Before I start, I would like to declare a conflict of interest. I am closely involved with a website called gotheextramile.com, which provides subscription to MCQs for critical care exams like European Diploma in Intensive Care. I would also like to thank my dear friend Dr. Yash Javeri for allowing me to speak in this forum. Dr. Javeri is the administrator for the group The Intensivists that plays a huge role in bringing intensive care specialists together from India and many other countries. Now for this presentation, I would like to show a few questions on Go the Extra Mile. Let me take you to the website. Okay. Now on the home page, you will find a link for a free test, and at the bottom of the page there is a test called an approach to MCQ. Let's click on that test. It asks for a few details to be completed. Let me enter those. Okay, and then we start the test. A few instructions are displayed. In the real exam, read these instructions very carefully, and then the test starts. Be mindful of the time. Be aware that in many modern day online testing websites, the order of the questions is changed every time a test is attempted, and the order of the choices may be randomized as well, which means that you cannot rely on a subconscious bias on part of the examiner or the person writing the questions. Some examiners may have a bias towards D as the option or A as the option, but when a computer software randomizes the choices, that bias is taken away. Okay. Now the first principle I would like to point out here is that sometimes, even when you do not know the answer to a question, the examiners would have given you the answer in the question itself. You just have to pause and think. Let's see this one. So, which of the following are absolute contraindications for performing a MRI scan? Now, I have never read what are the contraindications, but I'm going to try and work it out. I am thinking that hip replacement can't be a contraindication. There are a lot of people out there with hip replacement grafts. Sternal wires can't be a contraindication for the same reason. Something which is magnetic, well, I think would be a contraindication. Non-magnetic, I would say not a contraindication. A PA catheter has a metallic coil. I am going to say it is a contraindication. Let's see how I go. Oh well, there you go. We got that one right. Okay. For the next question, I would like to say that look for a pattern in the options. Once again, even if you do not know the answer, just read the options very carefully, and even if you haven't read the topic previously, the answer may just fall in your lap. Let's see this question. Aspartate transferase, or AST as we usually call it, level is usually raised in all of the following except. Be very careful of the word except. It is easy to miss, and if you know only one of these options, say myocardial infarction, you would say, oh, I know it is raised in myocardial infarction, so that must be the answer. But when you say except, I know that this cannot be the answer. There has to be another option. So what is the pattern here? I am thinking that AST is an intracellular enzyme, so anything which involves cell death may be associated with rise in AST. So I'm going to click on COPD. Let's see how we go. Hey, there we go. Now for the next question, I would like you to think like an examiner. Now an examiner knows that you think all of the above is almost always correct. Now I have very often clicked all of the above when I don't know the options very well, but then if the examiner knows that is how I am thinking, they may carefully lay a trap for you. Let's see how. Okay, we have a 55-year-old female admitted to the hospital with pancreatitis, and essentially the question is, which of the following drugs may be used to relieve spasm of the sphincter of Oddi? Okay, I know glucagon can be used. I am not sure if pantoprazole and octreotide can be used. So I am thinking that maybe they are useful as well. It's just that I don't know about it. I don't know a lot of things, and perhaps this is one of them. So I am going to take a guess and click on any one of them, and let's see how I go. And I have let the examiner get in my head and force me an error. I could have stuck to what I knew, but I fell right into the trap, and the examiner had forced me an error over here. Okay. Before the next question, I would like to point out that the examiner knows that when you get excited and you think that you got this question, that's when you may make an error. Let's have a look. Okay. Now the graph here is a diagrammatic representation of pressure measured through the tip of pulmonary artery catheter against time. The graph may have been obtained either at the time of insertion of catheter or removal of catheter. The arrow that represents the transition from the atrium to the ventricle is, oh yeah, I know this one. So at the level of the atrium you see CVP like trace, and as it goes in the ventricle it starts to look like an arc-line trace. So I'm going to say this is the point. A is where it goes from atria to the ventricle. Okay, I'm going to click A and let's see if I've got it correct. Oh God! How did I get this one wrong? Now I see. Left atrium to left ventricle. Now if your PA catheter is in the vicinity of left atrium or left ventricle, obviously we are in a lot of trouble. Once again, the examiner, he knows that I am going to rush things, and he has forced me to do an error. Just like a baseballer teasing the off stump with every ball, forcing me to nick. Okay. The area under the curve for a drug D after IV administration will increase with. Okay, what principle are we going to talk about here? Okay, once again, this time we have to be careful. All of the above is not always correct. Alright, So area under the curve. Now I have to confess that graphs and charts are not my thing. I don't understand them very well. So how am I going to do that? Well, maybe I'm going to try and understand them now. So this is the concentration and this is the time, and the area under this curve must be called the area under the curve. Okay, so when is that area going to go up? Alright, let's see. So I am thinking increasing the dose will increase the peak, increasing renal clearance will shorten the tail, increasing hepatic metabolism will shorten the tail, and obviously it can't be all of the above, so I'm going to go with increase in dose. I am not going to let the examiner force me into an error this time. Let's see how I go. Oh, there we go. Got it right this time. Now before we go into the next question, I would like to say the answer is often right in front of you. Obviously if you know where to look, but some of the questions in the exam are not about your knowledge. They are about your temperament, about your focus, your attention. Let's see an example. Okay, your resident has taken a screenshot of the monitor screen for a 75-year-old male who's admitted to the ICU after right pneumonectomy. Oh, geez, this looks very scary. What do I do? Well, it looks like a non-sustained ventricular arrhythmia. Okay, I'm going to just give some magnesium, amiodarone, metoprolol, or do nothing. Well, I think I should do something. I'm gonna go by giving amiodarone for 24 hours. Let's see how I go. Oh no. Alright, where did I make the error? Now I see it. This must just be a transient disturbance, because on the same timeline this ECG looks fine and the outline trace looks fine and the plethysmograph looks just fine. This is so silly. I can assure you that ordinarily every day I am not so stupid. Let's try another question. Now before, everybody has a few topics that they don't want to read or they don't understand. Statistics and toxicology are my things, and every time I see a question on any of these topics, it gives me shivers. Now such questions are to throw you off balance. Do not panic, and if you sit there and try and think logically, you will be rewarded. Let's go through an example. Okay, now you're conducting a study in patients who present with acute pulmonary edema following acute MI. The data on which of the following parameters may be regarded as categorical data? Alright, I don't know what categorical data is, but I am thinking that it must be to do with some categories. Okay, I'm going to look for categories here. Cardiac index, body weight, troponin, gender. Well, this look like categories and this look like categories. Reading the question aloud may help you try and work out the answer. So I am going to go here with gender, male or female, and ICU outcome. Let's see how we go. There you go. Without knowing what categorical data is, I was able to work out an answer. Okay, we're left with one more question. Now, smoke and mirrors. Unnecessary detail may be provided just to throw you off balance. Now, when you go and look at a monitor, let us say for a patient with hypotension, you're looking at a lot of information, and some of it may not really be relevant at the time that you're observing the patient. For example, if a patient is hypoxic and you're monitoring the patient's intracranial pressure, that information may not be directly relevant at the time of observation for managing the hypoxia. Okay, let's see an example here. Let's go to the next question. Okay, a PA catheter for a patient in your ICU shows the following hemodynamic data. Okay, there is a lot of numbers and I am expected to tell what the cardiac index is. Now I know cardiac index is cardiac output per unit body surface area. So I need cardiac output and body surface area. I do not need these pieces of information. So I'm going to say 5 liters divided by 2 would be 2.5 liters per minute per meter square body surface area. And I can disregard rest of the information that has been given to me. Let's see if I've got it right. There we go. Excellent. Well done, Sumesh, Aurora. Let's just revise all the things that we have just talked about. So read the question carefully and the answer might just be given to you. Don't fall in the trap of all of the above. Don't rush. Look at the images provided very carefully. Don't be thrown off balance by topics that you don't know very well. And try and extract useful information from the noise. Just like in real life, there is too much noise in the system. I wish you very well for any exams that you may be appearing for. Thank you very much for listening to this talk, and thank you to Dr. Yash Javeri for letting me talk in this forum.